and welcome to Askimo TV. We're talking today to Dr. Jake Sloane. Dr. Sloane is a surgical registrar and trained aesthetics doctor. Hi, Dr. Sloane, how are you?
Hi, good morning, Joanne. I'm fine, thanks, and thank you for inviting me today.
Pleasure to be talking to you today. Dr. Sloane, let's talk today about botulinum toxin and how it can help conditions other than wrinkles. So what is botulinum toxin?
So botulinum toxin is a naturally occurring protein produced by bacteria. It was initially found in the late 1800s and was identified firstly as a poison produced by the bacteria. Nowadays, of course, it's a medically refined and purified protein used as a medicine to improve a number of medical conditions with the unifying factor that it relaxes muscles. It's most well used these days to improve wrinkles.
So what can it be used to treat other than wrinkles? Can you just tell me a few of the things?
Sure. So in my own practice, we can use it for more advanced botulinum toxin procedures. One of these is called a gummy smile treatment. What a gummy smile is in certain people, when they smile, they expose the upper gum more than others. And this is potentially perceived as a less attractive smile. So what we can do is we can relax some of the muscles very strategically in the upper lip and around the side of the nose, just to weaken that muscle and its pull on the upper lip, just to create a nicer, more aesthetically pleasing smile. We can also use botulinum toxin in other ways. For example, we can treat one of the main biting muscles on the side of the face, so-called masseter. This is one you can feel when you clench your teeth. We can do this for two reasons. In certain people, they grind their teeth. This is called bruxism. And often people are unaware that they actually grind their teeth, but then they present to their dentist with eroded teeth and in some cases damaged teeth due to the severity of their grinding. So what we can do with a few simple injections just to that muscle on the side of the face is just take away the spasm of the muscle, get it back to a more natural pattern without weakening it to the extent that you can't eat, of course. And that generally improves patient symptoms, often with the occasional top-up of botulinum toxin to tinker with the correct dose that they may need. In the same way, and treating exactly the same muscle, we can cosmetically improve the appearance of someone's jawline when viewed from square on. For example, in a female with quite bulky muscles to the side of the face and very well-developed muscle, this again is maybe a potentially unfeminizing look. So we can use the injections to slim down the muscle to create a more narrow triangular lower face and then again a nicer aesthetic outcome. We can also use botulinum toxin, should I say, to weaken some of the muscles of the lower face and even the neck. So part of the aging process is that tissue tends to sag down around the jawline and around the neck, sort of losing the jawline, which is seen as less youthful. So what we can do is by, again, strategically injecting some of the muscles of the neck and around the lower part of the jaw and even mouth, we can stop these muscles pulling down and create what some people have termed a non-surgical liquid facelift.
What about things like headaches and sweating? Can things like that also be treated?
Absolutely, yes. These are also available by myself. So for headache treatments in particular, these are not always caused by muscle tension, but if the muscle is the particular problem, botulinum toxin treatments would be indicated. Patients should, of course, visit their general practitioner in the first instance to investigate their headaches. But once these headaches have been investigated and there is no serious underlying cause and it's been diagnosed as a tension headache or migraine, which appears to be chronic and periodic, these patients may well be suitable for botulinum toxin injection treatments. And what we do is, depending on the patient's area of complaint, for example, headaches of the front of the head or the side of the temple or back of the head or even the neck, we can use botulinum toxin injections to weaken the muscle, taking away that tension and the consequence is taking away the pain as well. For the sweating treatments, the most common indication is for patients who have uncomfortable underarm sweating. This is known in the medical profession as primary axillary hyperhidrosis. But we can also treat patients who have uncomfortable forehead sweating, chest sweating, back sweating, and even sweating of the palms and the feet, albeit this is a very painful procedure. So for the underarm sweating treatments, typically patients complain of sweating in inappropriate situations, for example, in social situations where they might be a little bit more anxious or nervous, or in an unnatural environment to them. Maybe doing a public speech, for example, is a very common cause of primary axillary hyperhidrosis. So in a sitting, in about half an hour or 20 minutes, we can do a quick procedure involving a number of painless injections in the underarm. And typically patients get excellent control of their sweating, sometimes up to 95%, where they find wearing clothes more manageable, they feel more comfortable in themselves, and their confidence has improved. And the result lasts for up to about 6 to 8 months in some patients.
Thank you, Dr. Sloane. Thank you so much for talking to me today.
That's a pleasure. Thanks very much for inviting me again, Joanne.